The first Ministerial Conference on Ending Violence Against Children was an important milestone and a critical step to advancing the issue. It brought together a wide range of stakeholders who are interested in prioritizing this issue by taking action. For instance, by allocating increased resources, influencing supportive policies, and making commitments that will facilitate the development and scaling of innovative solutions to address violence globally.
The conference was important because it highlighted the scope and the scales of violence against children worldwide, including physical, emotional, and sexual violence, as well as neglect, exploitation, and harmful practices such as child marriage. Also, it provided a platform for nations to share best practices, strategies, and lessons learned in efforts to end violence against children. And it aimed to create a shared global commitment to accelerate progress towards the UN Sustainable Development Goal SDG 16.2, which called for the elimination of abuse, exploitation, trafficking, and all forms of violence and torture against children.
There were many important outcomes of the conference. For one, country pledges were made by over 100 countries, some of which banned corporal punishment in all settings. Given the important role that parents play in preventing violence against children, many countries committed to investing in parental and caregiver support programs and trainings to improve relationships and create safe and secure environments. Many countries also pledged to strengthen policies and develop action plans to address violence against children in their own contexts. Another major outcome involved raising awareness of the powerful role that young people and survivors of violence play in advocating for and encouraging change to address violence against children. We need to continue to meaningfully engage young people and survivors of violence as champions so they can provide insight and guidance on how to best address violence in specific contexts and to take action to keep this issue on political agendas around the world.
Holding key stakeholders accountable for ending violence against children requires a multifaceted approach that includes monitoring and reporting, an independent oversight, clear accountability frameworks, civil society engagement, international cooperation, and public advocacy.
We have a responsibility to engage those closest to the problem, to identify needs and barriers, and most importantly, to offer impactful solutions. The Being Initiative supports bottom-up interventions by prioritizing the funding of youth-led innovators to develop and test novel solutions to complex mental health challenges in their local contexts. We believe that the knowledge and expertise of these grassroots implementers is the best way to test and identify effective approaches.
The mental health community has a crucial role in addressing the effects of violence on children and promoting prevention. Actions that the mental health community can take include raising awareness about the psychological and emotional impact of violence on children, advocating for trauma-informed care and support services, training mental health professionals in recognizing the signs and abuse of violence and providing appropriate intervention and support, supporting prevention programs that focus on mental health promotion, emotional resilience, and conflict resolution skills for both children and caregivers, providing therapeutic services to child survivors of violence that help them to heal and reintegrate into society, supporting recovery from a trauma, and helping them to cope with any mental health challenges.
Another way that mental health community members can support this agenda is to move away from siloed ways of working, to come together to understand what each is doing in the youth mental health space, to also encourage learnings across disciplines and sectors, and to develop a shared agenda with shared goals. The Being Initiative funds 3 different research streams in the same context because we want to focus on understanding potential facilitators and supports for youth mental health innovations, as well as the next steps for scaling and creating enabling environments within a national context. Through Being's Ecosystem Catalyst grants, we also encourage teams to learn from each other and establish a well-connected network that supports effective knowledge translation of new solutions and strategies for scaling.
To end violence against children, we must create a global culture of respect for children's rights, where governments, communities, and individuals work together to prevent and respond violence, ensuring that all children can grow up in safe, nurturing environments when they can promote and take care of their mental health.
We must meaningfully engage with children and young people to ensure they are involved in addressing this issue. Their voices should be at the forefront so they can highlight problems and develop solutions that resonate with them and the contextual factors that they're faced with on a daily basis. This will ensure that solutions are relevant and appropriate for those who need them the most.